This is Carol, 41 years old. She has an active lifestyle, with a happy family. She works as a CEO of a big company. Her symptoms began 10 months ago. She has brain fog and fatigue. Edema is present on her hands and feet. She has joint pain and mouth sore. She bruises easily. Carol was diagnosed with diabetes mellitus, endometriosis, COVID, Lyme disease, mononucleosis, and hepatitis A. Her grandfather had prostate cancer. Aunt had breast cancer. Mother is hypertensive. Father had diabetes and lung cancer. Her cousin had brain cancer. Her main complaint is fatigue, and generalized pain. So, the doctor gave her paroxetine, SSRI, and NSAIDs, COX-1 inhibitor. Recently, she experienced pain on the right side of her abdomen. She has itchy skin and rashes, watery stool, and insomnia. What could be the problem of Carol? Is it anemia, cancer, bile duct obstruction, or autoimmune disease? Carol has very low iron. She is extremely anemic. Increased GGT, gamma-glutamyl transferase. Increased ALT, alanine transaminase. Increased CRP, C-reactive protein. Normal serum bilirubin level. Celiac was positive with blood work, but negative with endoscopy. Positive ANA, anti-nuclear antibodies. Positive AMA, anti-mitochondrial antibody. The MRI shows normal liver structure. Bile duct is not dilated. No liver fibrosis, but with mild fatty liver. The spleen is normal. A positive AMA is 93% sensitivity and 98% specificity for primary biliary cholangitis, PBC. Formerly called cirrhosis. Positive ANA is 20% to 50% of PBC patients. However, the MRI doesn't show autoimmune cholangitis. According to the research, sometimes biopsies will miss the bile histology. Is it also possible that MRI will miss something? Positive ANA is sensitive but not specific for the detection of several autoimmune diseases. If GGT is greater than 15 units per liter, with serum bilirubin of over 2.8 milligrams per deciliter, strongly suspect for biliary obstruction. Carol has more than 80 units per liter, which is greater than 15 units per liter. GGT enzyme is highly represented in cells of hepatobiliary tract, which relates to liver and bile. GGT is especially elevated in disorders of this region like liver disease, infections, mononucleosis, and primary biliary cholangitis. Increased ALT means liver cells are damaged or inflamed. Increased CRP means infection and inflammation. By looking at blood work results, it is likely that MRI misses something. The closest diagnosis for the case of Carol is primary biliary cholangitis, PBC. Her signs and symptoms coincide with PBC, especially itchy skin and rashes. If a person did not put something into his skin that cause an allergic reaction, itchy skin is strongly related to bile duct obstruction or liver disease. Because of the obstruction, the bile accumulates into the circulation, causing itchy skin and some forms of rashes. The right side abdominal pain tells us the area that is affected is liver or structures near the liver. With regards to blood work, positive AMA is 98% specificity for primary biliary cholangitis, PBC. Plus, other liver enzymes are increased, which supports the diagnosis. PBC, or primary biliary cholangitis, is an autoimmune disease. It is caused by an immune attack on the small bile ducts within the liver. But what is the cause of an immune attack? If we take a closer look through the medical history of Carol, she has COVID, Lyme disease, mononucleosis, and hepatitis A. Even though she was declared clear from these infections, she still has inflammation based on her blood work. According to Dr. Alex Vazquez, persistence of inflammation, following resolution or antimicrobial clearance of infection, suggests retention of the microbial trigger. Microbe-triggered inflammation and autoimmunity can persist following antimicrobial treatment. Carol is extremely anemic. She has low iron. When a person has low iron, it tells only two things. 1. Low in iron from diet, or malabsorption of nutrients. 2. Infection. From the case of Carol, we can say that she still has the infection. Normally, when there is an infection, the liver will hide the iron, so pathogens, virus or bacteria, can't get iron as their fuel of survival. So, it's not necessary to provide iron to Carol. If you provide iron to Carol, it's like feeding the virus or bacteria, to survive and replicate more. Based on the case of Carol, infection causes fatigue. It is also possible that her previous long-duration antibiotic treatments damage the villi of the intestine, and antiviral treatments cause gut dysbiosis, making the intestine incompetent in absorbing the nutrients. Malabsorption of nutrients makes Carol feel tired, and have no energy. Aside from infection and malabsorption, a diet high in refined carbohydrates and fats generally cause chronic fatigue. We can say this is one of the culprits, because Carol is diabetic. Her family and relatives have cancer. Though cancer is not a genetic disease, the main cause of cancer is glucose and glutamine fermentation, that causes insufficient respiration to the mitochondria of the cell. 1. Starve the pathogens that causes the infection through the following. A. Eliminate refined carbohydrates from diet. B. Low carbohydrate diet. Many human trials show that 100 grams of glucose leads to alteration of inflammatory response and immune suppression. Conversely, carbohydrate restriction promotes mitochondrial function. C. Fasting. 3-day water-only fasting rebuilds your blood and starves pathogens. D. No iron supplementation. Chlorophyll is the most effective for anemia, without feeding the pathogens, because it is alkaline. It acts like a blood transfusion. Try making a fresh green leafy vegetable juice. 2. Fight pathogens by A. Vitamin C. When a person is sick, taking a large dose of vitamin C at once, 2,000 to 5,000 milligrams, is far better than taking smaller portions of that total amount over many hours. When you are well, take at least 500 milligrams daily. It is advisable to take fresh lemon juice and vitamin C supplements, to avoid the formation of oxalate, which is not good for your kidneys. B. Garlic. Though garlic somehow makes you antisocial, it is antiviral and antibacterial. 3. Restore gut lining structure, through alkaline diet. Eat more raw fruits and vegetables than cooked food. If you find this video helpful, please like and share. And don't forget to subscribe. To learn more, get the full course. This course will give you a complete understanding on how our body function, in order to cure your illness today, in a simple and holistic manner.